started. I'm Melinda Lopez. I have over a decade of experience working as an emergency veterinarian. And this is Tatiana. She's a Recover certified veterinary technician. And we work together quite a bit. We were chatting and we wanted to provide the community, the pet owners, something of value and also for WAG. So that's why we're holding this workshop. I'm hoping that some of the skills that you get in this workshop will help you feel more prepared for emergencies, but ideally avoid these situations altogether. So we'll talk about some strategies for that as well. First of all, we just want to recognize and commend all of you for taking time out of your day to learn, to become more informed, and to be the best possible pet guardian that you can be. Just the fact that you have shown up here and expressed interest that you want to learn more and become more knowledgeable, more informed, really distinguishes you from more than 99% of people who have pets. And so, good job for you guys. It really says a lot. We also acknowledge that we are hosting this workshop on the unceded and traditional territories of the Squamish Nations, and WAG actually receives a lot of pets from their communities. They're very underserved when it comes to veterinary care. Most of the surrenders, at one point it was more than 90%.
I would say 90%.
Came from the First Nations communities where average incomes are $24,000. People live in poverty, and a third of the dwellings are in need of repair, meaning ceilings, walls, electricity, plumbing, and often they don't have transportation to get to that care. So we receive a lot of surrenders from their communities because they are underserved, and I just want to recognize that we're very grateful to live and work here. This is a fundraiser for Whistler's Animal Shelter, and so thank you for hosting this event and helping us to make a more informed pet owner community. And we encourage all of you to help support them further through volunteering, fostering, and donation. They need as much support as they can possibly get so that they can continue their amazing work for the pets in this area that are in need. Kita is the shelter director, so if you have any questions about volunteering or donating or how you can help more, please reach out to her and she can definitely help you with that.
I'm here all the time.
Yeah. So tonight's workshop is not a replacement for more in-depth courses like the Recover certification, which we'll talk about, and that is currently the gold standard in veterinary medicine. But tonight we hope to familiarize you with the basics of Pet CPR to cover the most important points of out-of-hospital BLS, so out-of-hospital basic life support, and get you some practice. So we're going to start out with an overview, basically backgrounds, definitions, brief heart-lung physiology, and then a basic walkthrough of Pet CPR guidelines as they stand currently. Then we are going to do a demonstration for you, Tatiana and I, and then we'll all do CPR practice on dummies until everyone feels confident. And then we're going to discuss prevention, which is all of the important strategies to keep your pet safe, to avoid the types of situations that culminate in CPR. And at the end, there will be a quiz. The science has actually shown that improved learning and improved performance outcomes have been documented when CPR trainings culminate in performance testing. So you can blame the science for the quiz. But most importantly, we want this to be a fun, relaxed, supportive, judgment-free zone. CPR is for everyone. Even kids regularly save lives by knowing how to do CPR. It's for everybody. You don't have to be a good speller. You don't have to have a degree. You just have to know when to act, or even if everyone else is hesitating and standing around watching. Just do your best, and the rest isn't up to you. I just want to recognize that the information I'm sharing with you is not my work. So it's the result of thousands and thousands of hours of research and writing by other people in the veterinary profession, mostly veterinary emergency and critical care specialists who are constantly working to improve medical care for pets. They work so incredibly hard, and I want to direct you to their publications for more information. I'll make these available to you. First, we're going to start with some background on CPR. The statistics are really sad. So less than 6% of pets, and actually some of the studies will get numbers closer to 2%, of pets experiencing in-hospital cardiopulmonary arrest will survive to hospital discharge, meaning will go home. So for every 100 times you're dealing with an in-hospital patient that arrests, it's very, very unlikely that they will go home. Overall, the survival rates are very, very poor, and there are a lot of reasons for this. In humans currently experiencing in-hospital CPA, 20% will go home. So there's a big difference there. Now, there have been incredible advances in veterinary medicine over the last several years, but we haven't really been able to budge these numbers. And then survival rates for pets receiving CPR out of the hospital, which is what we're talking about. Say you come across a deceased pet, an arrested pet in your home or out on the field, or you're there for an accident or an intoxication. All of this stuff happens all the time. I can't tell you how many times I've had to walk owners through CPR in the back seat of a car while somebody is driving. So it happens all the time, and I'm always very proud of them when they do a really excellent job, or at least try. And a lot of times, if there's a problem that we could have fixed, that would have made all the difference in the world, the fact that they actually kept the blood flowing. So before the human side of things started instituting evidence-based CPR guidelines, mandatory training for hospital personnel, a huge push for the public to learn CPR. I mean, I remember in the 90s there was a huge push, and that was because they started to do a system-wide review and say, hey, we need to train people. There are all different levels of CPR, but just basic life support, something for everybody to know. Before the human side of things started to do that, the survival rates in humans were just as bad as they are in pets now. The improved outcomes in human survival are largely attributed to the institution of guidelines and standardized training. So that's why it's important that we all do this. So historically, veterinary CPR recommendations were largely extrapolated from human medicine. In the past, we had no standardized guidelines or training for veterinary patients. This has led to extreme variability into the approach of CPR and has likely contributed to the poor outcomes. The problem with applying human CPR guidelines to pets is that there are major differences between humans and pets. So everyone thinks CPR paddles, right? And there's a reason for that. Most out-of-hospital cardiopulmonary arrest in adults is cardiac in cause, and VFib is ventricular fibrillation is a shockable arrhythmia. It has to be shocked to stop it. That is not common at all in pets. Kids, on the other hand, most pediatric arrests are asphyxial. They're choking. They can't breathe. Similarly, only 8% of dogs and cats in cardiopulmonary arrest have that happen because of cardiac arrhythmia. So most of the time, there's something else that causes the heart and lungs to stop working. Respiratory problems, trauma, hemorrhage, metabolic diseases, electrolyte derangements, all of these other things. So when we're doing CPR on a pet and people don't understand why we're not using the paddles, it's because we don't see a shockable rhythm. Electrical defibrillation is not useful or indicated for the heart rhythms that are present in the vast majority of veterinary patients experiencing cardiopulmonary arrest. It's usually a flat line or pulseless electrical activity, but not shockable. So that's why all of these recommendations for human adults mostly, they might be causing worse outcomes. If we could get a better evidence-based approach, maybe we could do better. That's where Recover comes in. In 2012, for the first time ever, so over 10 years ago, something called Recover happened. Basically, over 100 board-certified veterinary specialists from around the world, mostly in emergency and critical care, volunteered their time to create the veterinary industry's first ever evidence-based CPR guidelines. And they reviewed all of the literature. And they devised a series of evidence-based consensus CPR guidelines for dogs and cats. They had two goals. So develop guidelines for dogs and cats, and then identify the knowledge gaps or areas that require further investigation. And they also are developing CPR courses, not only for veterinarians, which is really the emphasis, but also for pet owners, pet professionals like dog walkers and dog sitters. And they even have a new one coming for first responders and also all of the dog handlers. And so this is the gold standard in our industry, and this is where all of the knowledge is coming from, is Recover. And then June 26th of this year, they've just released the first updated guidelines. So that's like more than 10 years later, they have revisited it and they have updated as much as possible what they could. So there are some changes. So that's a little bit of background. Next, we're going to move on to a basic overview of the circulatory system so you understand a little bit how the heart and lungs work and why it is that we need to prioritize certain things. So we've got gases and then we have the circulatory system. So oxygen, it's all about oxygen. Oxygen is king. Every single cell in our body, trillions of cells, are absolutely dependent on oxygen to survive. And if they don't have it, they will die very quickly. At some point, the cell actually disintegrates and those changes become irreversible. You have only minutes before the brain will experience damage in the deprivation of oxygen. It's at roughly 5 minutes. Some of those changes can be irreversible. The heart muscle itself gets oxygen from the coronary arteries. So those are little arteries that branch off the heart. The priorities are basically we want the heart muscle to remain intact. We don't want any dead necrotic areas in the heart that aren't getting oxygen. And we want to preserve the brain function. So oxygen is king. We need to get oxygen out of the air. It's about 21% of the environmental gas is oxygen. And we need to get it into our body. And then we also, CO2 is basically a waste gas of metabolism. As your cells are metabolizing things, they're going to create CO2, carbon dioxide, as the waste. And if that builds up in your body, it's a toxin. And so you need to get it out of your body. So oxygen in and CO2 out. But oxygen is so, so important. So Team Oxygen, there's a unit of 3 main things that get the oxygen to your cells. We have an amazing system of getting the oxygen out of the air into our bodies and then circulating it around to deliver it to the cells. And it's basically these 3 guys: the heart, the lungs, and the blood. I'm going to start with the blood. You'll notice some of those vessels are blue and some are red. Everywhere in your body, they run in pairs like that. The red ones have the blood with oxygen, and the blue ones have the blue blood returning that has had its oxygen removed. So your blood, all these little red blood cells are carrying the oxygen to your cells through all of this network of blood vessels. When it has oxygen bound, he's really happy and he's red. So arterial blood, the blood with oxygen, is red. After the cells have taken all the oxygen because they need to use it, he doesn't have it anymore. So the red blood cells actually turn blue. When you see blue, that's a big red flag. So the heart is the pump, and not to diminish the importance of the heart, but he's just a pump. He's just pumping things around. If you look at your arm, you can see that you have veins, right? And they're blue. So they're bringing the deoxygenated blood that all the cells in your hand have used all the oxygen, and now it's returning to your heart. Arterial blood, on the other hand, if you feel your pulse in your wrist, that you can feel your arterial blood, the red blood, coming from your heart. And you can actually feel every one of those pulses is your heart pumping forward. Pump, pump, pump. The reason you can't see the red, like you can see all the blue ones, but you can't see the red, is the arteries have a lot of muscle around them, and they're thicker walls because they have to handle the pressure. So they actually kind of look white, but inside the blood is red. The veins, the walls are more stretchy. So the heart, basically what it does, it's going to receive the blue blood coming back to it that's had the oxygen basically utilized from the tissues. It's going to collect that, and then it's going to pump that into the lungs where it's going to get oxygen. And then on the left side of the heart, it's going to receive the freshly oxygenated blood coming from the lungs, and it's going to pump that out to the body. So it's just a pump, and it's really important. The lungs is kind of where the magic happens. Your blood's circulating around, your heart is pumping it, but your lungs is where gas exchange happens. So that's where you actually get the oxygen out of the environment and into the blood. So every time you breathe in, you're breathing in air, and then that air is going to go down into your windpipe, your trachea, and then your trachea branches into smaller airways. And to be honest, it looks like an upside down tree. So it basically just branches and branches and branches into smaller airways. And then at the very end, kind of where the leaves will be, that's where gas exchange happens. And that's where we get the oxygen out of the air and into the body. So at the very bottom of these airways here, it ends in this little sac called the alveolus. It's actually, they're like little clusters of air sacs. And that's at the very end of all the branching airways. It's almost like a cluster of grapes. But if you look at a microscopic cross-section there, it's really just like bubbles of gas. And the walls of these bubbles are so thin They're just surrounded by blood vessels. It's so thin that the oxygen can actually just travel directly across the wall into the blood. So if your red blood cells are sitting there and like they really want oxygen because they're blue, and there's 21% oxygen in the bubble, it's just going to travel across a concentration gradient right into the bloodstream, and then your little red blood cell will grab it and it's going to be all happy again, and then it will make its way to the heart so that it can get pumped out to the circulation. And same thing, when you have all this CO2 building up in the vessels, it's going to diffuse across that really thin wall into the little alveolus. And then when you breathe out, it will be swept away with all the rest of the air. Your lungs are almost like a dry sponge, right? It's really light, it's fluffy, it can move, it's really elastic. When you have problems like pulmonary edema or pneumonia where you have the lungs filling with fluid, these little sacs of air are going to fill with fluid, and then you can't get gas exchange. And it also is going to make your lungs, instead of like a nice fluffy wad of bubbles, it's going to be really heavy, like when you jump in water with your clothes on. And it takes so much more effort to expand them, and it just becomes really heavy. Then ventilation is basically just the process of the lungs expanding and contracting so that you can breathe in oxygen and breathe out CO2. It's an automatic process. It's so important to survival that it's all automatic. You can be sleeping. You don't have to think about breathing. You don't have to think about your heart pumping. You don't have to think about the blood circulating. It happens 100,000 times a day, 2.5 billion times in your lifetime. There are factors that can speed it up or slow it down, and you can also voluntarily do that as well. But the bare minimum to get your cells the oxygen that they need, it's all automatic. Your heart has basically its own internal battery, spontaneous electrical activity. You can remove it from the body, and under the right conditions, it will continue to beat because it's just this amazing little automatic pump. If it stops and you can get started again with a normal electrical rhythm, well then you get the pump starting again, and then that's half the battle. Just reviewing, bring the oxygen in, put the oxygen in the blood, pump the red blood around, and then blue blood goes back to the heart so it can get more oxygen in the lungs. Some basic definitions. Cardiopulmonary arrest. That is a lack of spontaneous, automatic respiration and circulation. In most instances, it's the common pathway preceding death. During CPA, oxygen delivery to the tissues in the body suddenly stops. At that point, the clock is really ticking. You do not have a single second to waste. If it goes on for long enough, the cells will die and the changes are irreversible. CPR is a cardiopulmonary resuscitation. It literally means heart, lung, bring it back to life. It's a life-saving emergency procedure that can keep oxygen-rich blood flowing and circulating around to the organs until a normal heart rhythm can be reestablished. The primary concern is to provide oxygen delivery to the heart and to the brain so that they will start working again automatically if given the chance. So whatever the underlying cause is, if that can be quickly corrected, we want them to still be viable so that they can start up again. ROSC, return of spontaneous circulation, that basically means you get it started again. You know that feeling of your car has died, trying to start it? It's just like that. If you can just get it started again, then it is so much more effective than we are at pumping the blood around. When you're doing chest compressions and you're doing CPR, at best, it's thought that you can deliver about 30% of what the heart can. You really need to get the heart going again because it's so much more effective. Is everything okay?
Yeah.
Okay. Following, any questions so far?
Well, you said 30%. I mean, what I do will get 30% and the heart will take over?
Yeah, so say the heart is stopped.
Right.
The patient is not breathing. You start doing chest compressions and you're doing your very best ones. When you're doing chest compressions, you're trying to basically be the pump, okay, outside of the body. But the heart is so effective at pumping that at best, you're doing your best compressions, you might be getting 30% of the blood delivery. So 30% of the output, 30% of the flow. So you're not a very good pump, even at your very best. So you need to get them. The priority, the overarching thing that you need to remember is we need to get them into the ER. And we'll talk about this in a second. We're going there. So those are just 3 definitions regarding CPR. And then CPR itself has 2 main aspects. So there is basic life support, which is what we're going to talk about today, and then there's advanced life support. BLS, basic life support, means recognizing cardiopulmonary arrest quickly, swiftly starting intervention, which means airway management, ventilation, and chest compressions. So the ABCs. Advanced life support extends the scope of that. Okay, so ABCs out of hospital, when we talk about airway management. Out of hospital, you're not going to be able to manage an airway as effectively as the hospital will. When you get them to the hospital, they're going to do a better version of airway management, which means they're going to put an endotracheal tube in so that the airway is under a lot more control. When you're giving rescue breaths, it's really hard to get as effective of ventilation as you can with an endotracheal tube in place and a bag that you're squeezing and 100% oxygen hooked up to that. But
Sorry, can I ask, is that in hospital then?
yeah, so out of hospital you can't do that. You're just doing mouth to snout, and we'll go over that in a second. The shorter the duration of BLS out of the hospital, like the quicker you can get in, the better. Then when you get to the hospital, advanced life support takes over. And yes, paramedics, they're going to be arriving with a lot of those modalities. They're going to have the ability to intubate. They're going to have 100% oxygen. They're going to have the ability to place IV catheters, get venous access, get emergency drugs on board. But we don't really have that in our profession. So advanced life support extends beyond ABC to include really extensive monitoring. You're looking at the oxygen levels in the blood, you're looking at the CO2 levels in the blood, you're looking at the actual cardiac rhythm, EKG, you're doing defibrillation when needed, and then you get IV access. Meanwhile, you're also trying to figure out why did this patient die, correct all of the life-threatening problems. I mean, if they have bled to death, you could have a very healthy heart and a very healthy respiratory system, but if you don't have enough of those little red blood cells to carry the oxygen, I have had to do CPR while also simultaneously administering a blood transfusion because we knew that that patient had died because of blood loss. So there are a lot of pieces, especially in pets, because it's a big mystery a lot of times why they died. And you have to, while you're doing CPR, not getting optimal flow compared to what the heart would get if it was working, you're trying to figure out why did they die, how to fix that, while you're just basically buying time, pumping and breathing for them. Okay, so out of hospital BLS, which is what we're going to do, is basically, this is it. Keep it simple. You need to recognize CPA and call for help, and then do the ABCs. So airway, breathing, chest compressions, and most importantly, swift and safe transport to the ER. Somewhere that can take over BLS, can do the intubation, can do the oxygen, can get them hooked up to all the monitors, can establish venous access and give emergency drugs, try to get the heart pumping again, and try to correct whatever the underlying problem was that got us here in the first place. So we're going to do a little walkthrough of what the recommendations and guidelines are. But first, I just want to say safety first. There's 1,000 stories. Every year, somebody does this. Turns one tragedy into two. That dog goes way under the ice in a raging river in Alaska. You got to always stop and remember, always assess your surroundings, especially with motor vehicle stuff, fire, toxins, drowning. Consider the mechanism, the method, and just please do not make things worse by putting yourself in danger. This lady had a bunch of kids. It was really super sad. They found her at the bottom of the river holding onto her dog. It was just devastating. Always remember safety first. Basically, unresponsive, not breathing, start CPR. You need to call for help.
A little help, please.
Because you need somebody to help you get out of there as quickly as possible. Call for help, somebody with a vehicle. You need as many helpers as you can. You're going to do the shake and shout, so you're going to stimulate them vigorously. If they're not responsive, you're going to check in and see if they're breathing. And then you're going to start single rescue or BLS, which is check the airway, compressions, and ventilation. Wasting time for confirmation of CPA by pulse or EKG is not recommended according to the current recommendations. And CPR should be initiated aggressively and immediately upon recognizing a patient that is unresponsive and not breathing. Delaying worsens outcome, unlikely to cause harm. Okay, when an unresponsive patient is encountered, call for help.
A little help, please.
They're not responding. You call their name, stimulate them vigorously. You look to see if they're breathing and they're not breathing. Unresponsive, not breathing. I just want this in your mind. Unresponsive, not breathing, start CPR right away. So you come over.
A little help, please.
Unresponsive, still unresponsive, not breathing. start CPR right away. Just move forward, start CPR. Unresponsive, not breathing, start CPR right away. It is not recommended to check a pulse. It takes too much time. If the patient is unresponsive, is not breathing, and only one person is available to start BLS, in pets, it is recommended to take 5 seconds, 10 seconds to look in the airway. You're going to want to extend the head and neck so that opens the airway. You're going to want to pull the tongue all the way out. When it's very, very, very slippery, I usually will grab something cloth, the sleeve of my hoodie, to pull the tongue out and then to wipe away all of that stuff. You're going to open it as wide as you can and look back in there, extending. If you see something in there, just be really careful to not push it farther in. There's a new technique for choking. Have you guys come across that? I'll send it to you too. But for unresponsive patients that have airway obstructions due to balls, there's a new technique to dislodge them. So if you see something like that, it'd be helpful to know that quick technique to dislodge the ball and then start CPR. And you just want to do this all as quickly as possible as far as the airway. Go ahead and clear the airway, then do C. Go straight to compressions. Chest compressions. So basically you're trying to pump for the heart. I'm going to go through the recommendations with you. So hand placement depends on the patient's size and breed and conformation. The rate of chest compressions is 100 to 120 per minute. It's going to be important to practice a lot so that you know roughly how fast 100 is and 120 is. And you want to minimize interruptions as much as possible. If there's 2 rescuers present, you're ideally doing 2-minute cycles and then switching so that the person doing compressions doesn't get fatigued. Body position, again, all this stuff is from Recover. You want your hands and fingers interlaced. The main tool that you're going to use, like say you have a hammer, right? If you're like swinging it upside down, it's not going to be as effective. So the heel of your hand is like the head of the hammer. So that's the part that you really want to be using. You want your elbows to be locked and straight, your hands directly below your elbows, and you want to be using your abs. So the force of your trunk and body, not your biceps and triceps. Okay, this was from the 2012 one, but I like it. It just kind of shows the different chest conformations. In most dogs, their chest is kind of round, like it's dome-shaped when they're lying on their side, like this. So almost all dogs, like Labradors and most of these guys, it's a dome shape. So you're actually going to position the heel of your hands. The compression point for them will be the widest point, the tallest point of the dome. So the widest point of the chest when they're lying on their side. It shows a little shadow of the heart, but you're not going directly over the heart necessarily. Now, keel-chested dogs, when you lie them on their side, they love talking about how it's like a ski slope. It's like more triangular. It's basically thin-chested dogs. So like greyhounds, whippets, all those guys. Those ones, the compression point will be directly over their heart. And the way that you find their heart is you take their elbow, draw it straight back, and if you could divide the chest when they're on their side into thirds, it's in the first third right there. If you have a keel-chested dog and you're watching them, like I had a keel-chested dog, I could see her heart beating from across the room, and I could count her heart rate because they're skinny. And then you have these wide guys, bulldogs. They call them barrel-chested or wide-chested dogs, where their chest is actually wider. It's more like ours. Well, those guys can't really lie on their side very easily because they roll. So they are thought to be better done lying on their backs, more like people with the compression point directly over the sternum, over the breastbone, over the heart. Cats and small dogs, so anything under, in 2012 they said 10 kilos, but now they changed it to 7 kilos. But little guys, you're basically just squeezing their heart between your hands.
They're on their back.
They're on their side for this one. Yeah, they're lying on their side. Here's the updated illustrations for cats and small dogs. So you can choose any one of these 3 to compress directly over the heart. This is the 2-thumb technique. I think the 1-thumb for me is very effective, but your hand gets so tired that you might need to switch to 2-thumb.
So large breed like Maine Coon, you would go.
Yeah, I think for Maine, you might be two-handed. I think even in a Maine Coon, when it comes down to it, their chest is so skinny anyway. And honestly, Maine Coons have so much heart disease. It's crazy. There's no oversight of breeding. Nobody's really making sure that the breeders are checking to make sure that they're being bred with healthy hearts. There's a lot of screening that can be done. There's even genetic testing, but it's a free-for-all. Anybody can breed a Maine Coon. They have rampant heart disease. So if you have a Maine Coon, and they haven't been tested, you might need to learn this. They're just an accident waiting to happen. Okay, you must allow full recoil of the thorax between compressions to allow the heart to refill with blood. So all of these techniques, you really need to go for it with vigor, no wimpy compressions. But just as importantly, the heart fills passively in relaxation. So you need to get all the pressure off between compressions, allowing full recoil and full expansion. That's just as important. One reason they want people to switch is that they find when people are getting fatigued, they won't allow recoil. Again, they'll start leaning on the chest, and then they'll also not be pushing as vigorously.
So are you breaking ribs like you do in humans?
It can happen. We'll go over the depths, but the idea is to not compress more than 1/3 to 1/2 when they're on their side. And you're also trying to not compress more than 1/4 when they're on their back. So if you're compressing 99% of the way every time, you probably will be more likely to break ribs. But if you're actually following the recommendations for depth, the ribs have a lot of cartilage, there's a lot of elasticity. You can, if you're in the correct compression point, compress the ribs during the CPR and not break ribs. I mean, you can break ribs from coughing too much. If it goes on long enough, it's expected there will be some bruising and they can break. But guess what? They might be alive.
Do you have any side that you prefer, or you?
No, you just want to start as quickly as possible is the main thing.
So it doesn't matter which side.
Yeah, it doesn't matter which side.
It depends. It doesn't matter which side unless there's a flail segment, like where it's a bunch of broken ribs and you're just going straight through the chest wall. Well, then obviously that's a really bad trauma patient. So stabilize their neck and spine. Quickly minimizing all interruptions, 1 to 2 seconds if you can. Make a plan with somebody. We're going to roll them and then resume compressions on the other side. The flail chest side goes ground side down, and then you start compressing on the other side. So rate and depth. So for all regular round-chested dogs, you're going 1/3 to 1/2 the depth of the chest at that specific point. And then here's the keel-chested dog again. Note the ski slope shape of the thorax when the dog lies in lateral. Lateral means on their side, recumbency. And then the depth is 1/3 to 1/2 the width at the compression point. For cats and small dogs, and dogs in their back, compress to a depth of 1/4 of the depth at that point.
I want to make sure I have this right. On the back, it's 1/4.
1/4, yeah. But all the rates are the same, 100 to 120 per minute. And it's always going to be in out of hospital basic life support, 30 compressions, 2 rescue breaths. 30 compressions, 2 rescue breaths. Oh yeah, here's the update. And then once you've done 30 compressions, you're going to give rescue breaths. And it's always going to be in out of hospital basic life support, 30 compressions, 2 rescue breaths. 30 compressions, 2 rescue breaths. Head and neck in alignment with the spine to avoid obstructing the airway. A compression to ventilation ratio is going to be 30 compressions to every 2 breaths. If it's believed that there could be personal risk in providing mouth to snout, for example, there was a dog, he'd eaten a bag of drugs, it was like cocaine or something, out of somebody's backpack, but they were doing CPR on it. That might not be one where you would want to do mouth to snout, or you might need to modify your technique so that your lips aren't directly on the nose. Or if, for example, the patient is known to have infection that's known to be transmissible to people. There are a lot of them, but rabies, for example. Safety first. Always think of the worst case scenario. Protect yourself. Okay, so is it ABC, CAB, or ACB? So it started out with ABC just because it's so easy, right? People, it's complicated. But then they changed the recommendations in people to CAB because it makes a lot more sense and people were delaying unnecessarily. But see, with pets, now they're saying do A first. Go ahead. Check the airway, go ahead and clear the airway, then do C, go straight to compressions, and then once you've done 30 compressions, you're going to give rescue breaths. So it's ACB in pets, if that makes any sense.
What the B stands for?
Breathing. Breathing, yeah. But at the end of the day, if you're doing your compressions, if you're doing your breaths, if you do the airway, all in the first minute, you've done all those 3 things, great, you're winning. You're better than 99% of people, but the giant clock that is ticking is how fast will you get ALS. Keep doing that, keep doing your compressions, keep doing your breathing. Obviously make sure the airway is clear, but you're just buying time poorly. 30% of cardiac output at best. We're almost done with this and we can practice. Okay. So you've already established that they are in CPA. You've shaked, shout, you've called for help. You're going to check in and see if they're breathing. When you have multiple rescuers, it's recommended that chest compressions be initiated without delay to assess an airway. So just go ahead and start compressions. And then the next person you see, you say, can you please check the airway? That's the end of that part of the presentation. I feel like we've gone way over. So let's go ahead and practice. So you can go online. There's free metronomes everywhere. Just type in free metronome. A metronome? It's something that just keeps rhythm for musicians. They're free online everywhere. You can choose the rate. 100 beats per minute. So this is 100 beats per minute. 1, 2, 3, 4. 1, 2, 3, 4. Here's 120. So I think 120 is hard to go that fast, personally, and do a good job and get enough recoil. So I tend to go closer to 100. 120 is fast. And I think if you're doing it that fast, things get sloppy. So, but go for it. Practice at all the rates.
And you said you have to have time for it to record.
Yeah, you have to push down and let all the way up.
I know, so I'm thinking that.
So yeah, so
The
so
1, 2,
120 is
3,
really fast. I prefer just like.
Okay, does that allow for the?
If you do, yeah, everything recoils quickly, but it's more operator. It's like you're gonna get sloppy. You're gonna get tired. Start pushing too hard and too deep. It's better to just keep it controlled, I think. But the recommendation is 100 to 120. In small animals, normally their heart rate is faster. So maybe in small animals, you might want to go on the faster side. Let's just do a quick demo. So Tatiana comes and finds her dog who's unresponsive lying on the ground. So she notices he's not moving, not responsive. Calls for help.
Melinda!
Okay, she's going to shake and shout.
I'm going and I'm shaking.
Unresponsive. Then she's going to see, is he breathing? He's not. Not breathing. Then she's going to assess the airway. So she's extending the head and neck. She's opening the mouth. So she's going to get a real good look inside. And she's going to clear the airway. She's going to try to get all that stuff out of there so he doesn't choke on it further. She's going to go ahead and start compressions. He's a round-chested dog, so she's going to find the widest point of the chest, just right there. Heel of the hand directly over the highest point. And then she's going to compress 1/3 to 1/2. Elbows directly under shoulders, allowing full recoil.
My arms are stiff and I'm hinging my hip.
And she's going to do 30, so she's going to be counting to herself. I usually like to count to 4. 1, 2, 3, 4. It just keeps me going on the right rhythm. 28 is 7 rounds, so by the time you get to 7, 2, 3, 4, right there you're just pretty much at 30. Time to give 2 breaths. So I just like going 1, 2, 3, 4, 2, 2, 3, 4, 3. But some people will count all the way to 30. And then you're going to give 2 breaths. So basically for that, it's mouth to snout. You're going to close the mouth all the way, make a seal with your mouth around the nostrils. And then you're going to give 2 breaths, and you're going to allow them also to breathe out. So a quick breath, and you're going to try to inflate the lungs normally as they would if the dog would breathe on their own.
You're blowing up the nose.
You're blowing up the nose. Yeah, dogs and cats are obligate nose breathers. So 30 compressions to 2 breaths. Going along with the metronome, you practice this at home with your family at 30, and then you're going to give 2 breaths, and you're just going to keep going. And meanwhile, I walk in. Oh, good thing I already have a plan for this, and we've practiced. So let me just go get the car. I'm going to bring it right over. I already have it figured out exactly where he's going to go in case this happens. I'm going to call the clinic and let them know how much he weighs and that we're doing CPR, and we'll be there in 4 minutes, according to Google Maps. Tatiana's doing compressions and rescue breathing, right? And I've gotten the whole transport scenario sorted because I'm captain safety, that's what I do. Then I'm going to say, Tatiana, at the next one, keep going, keep compressing, minimize interruptions, do not stop. At your next one, we're going to make moves for the car. Ready? 3, 2, let's go. Okay, let's go. And then we're going to slide them onto the mat, and we're going to go. We're going to get in the car. We put that one seat down. Tatiana, I'll continue compressions while you get your seatbelt on. And then I'll buckle up, and we're off, and we drive safely. And we'll have the clinic on speakerphone. And then we'll get there, and we'll be like, we're pulling in right now. Be ready for us with your stretcher out in the front. Okay, here we are. And then somebody will take over the compressions for Tatiana, and somebody will intubate her, and we'll be gone in VR, and then we let them deal with it. At the end of the day, the knowledge gap, the clinics, every opportunity, even in your DOAs, is an opportunity for training, and we need more training regularly. Every time we had a new person come, their first day we did CPR drills. Full CPR drills with all of the things, all of the bells and whistles, all of the drugs, all of the defibrillator, everything on stuffies, because I don't even know how many times it happened later that day or the next day we were doing the real thing, and then they felt so much more prepared. It's so common to find a day clinic that does regular CPR training because we lack the standard, the mandatory training, the coaching in our profession. It's just not there. I think we have enough stuffies for everyone to get one, so I think we should all practice. Choose one that's the closest size to your own animal. You have cats, right? Yeah, with them. Here's a bulldog. Bulldog.
Do we arch the neck or extend the
Extend.
neck?
You want to extend
it, and you want it in line with the spine.
This guy's wearing too much clothing.
I just do compressions. Don't worry about it. Like, don't take their clothes off. You're minimizing interruptions, all interruptions, as much as possible, unless it's for life-saving interventions only. So if you see like arterial blood spurting out of the neck, yeah, you're gonna need to put pressure on that somehow. So this is what you guys are going to do at home, homework. So you're going to get the metronome, find a stuffed animal, and you're going to do a scenario where you practice. You're going to have your emergency plan already in place. So every time you travel, make a plan. Insurance is huge because post-arrest care involves many, many days in the ICU. It's a long process for a lot of these patients to get back out the door. The thing I want to discuss is prevention. Prevention is key. Learn about all these ways. There's a couple scenarios. So sudden death, that is the vast minority. The other bucket is accidents. So strangulation, suffocation, choking, heat stroke, falling from heights, falling off the balcony, all these things, accidents. Most of those are preventable. Almost all of them can be avoided. Altogether, you know how to keep them safe. You learn all the ways. The third bucket, I call it waiting too long. Waiting, watching, waiting. So underlying medical problem, not getting medical treatment soon enough. Undiagnosed medical illness, they noticed it's progressing. All of a sudden, the animal's about to die. Then that's when they decide to bring it in. So taking too long to get to the emergency room. Any breathing problem, anytime you see a cat open mouth breathing, if you are worried about a pet's breathing, no matter what, get them checked because that is a few minutes and you're doing CPR. Sooner the better. White gums, urinary obstruction in cats. These are all situations I've done CPR on where if they had just come the day before, 5 minutes before, 2 hours before, when we talked to them on the phone and told them to come right in, if they had just come, we would not be doing CPR. We might have saved them. Bleeding, toxins, especially antifreeze has a very narrow window of intervention. Trauma, taking too long treating non-essential injuries but failing to stabilize life-threatening injuries. So the waiting, watching, not getting help fast enough also includes not getting the right help fast enough. That means not getting a referral to a specialist or a facility equipped with the skills, equipment, and personnel able to handle that problem. So many problems need to be escalated to a specialist. And I'm telling you this because you need to know it. Sometimes people bounce around to every vet, not getting anywhere, and they're spending all their money. They want help, but they don't know where to get it. And then it culminates in a CPR, when really what they should have said is, I wanted a second opinion. A second opinion means go up. Get a referral to a specialist. Don't be asking your friends. Don't ask Facebook. Yeah, so if you go to Twin Trees Vet website, we basically just turned it into a whole education thing. It's all free. Just trying to make a good impact. When I was injured, I made a free pet first aid course. And if you even just take section 1, you'll learn about ways to avoid emergencies. And then there's a homework assignment where you have to go through your house and make it safe. There's also a podcast. It's fun and it's all free. I figured that would be my gift to pets. So let's make the guardians more informed. So that's all I wanted to say.
Thank you.
Yay. Thank you. Here's some treats. If you guys want one.
I have to run. Thank you so much.
Under the same.
You're welcome.
Thank you very much.
You're welcome.
Hello.
Yeah.
Thank you.
So much. Thank you.
Bye there.
Good job.
Thank you very much.
Bye.
I appreciate that.